What is rehab or rehabilitation? My name is Fred Begaris, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab podcast. This has definitely been an interesting past couple of weeks with the recent shooting of the UnitedHealthcare CEO. I'm not really going to speculate on the motives, as obviously these facts are still coming out, but I wanted to focus on the discussions that this unfortunate tragedy has kind of brought up in the country, but even amongst my colleagues. From a physician standpoint, the things that insurance companies have been doing are just now coming into light. However, the denial of care and games that they play, this is not anything new. For as long as I have been practicing, this has always been how the insurance companies have played the game. I see a lot of the discussions, particularly of patients or people online, sharing their stories about the denial. And I think that might be a positive of what has happened. But again, it's not anything new. But I'm glad that it is coming to the surface because it's just, it's been always kind of hard to talk about from a physician standpoint. No one likes to hear other people's problems, and it unfortunately has been a very big problem for physicians and obviously patients. But I think from the patient's perspective, perhaps that maybe physicians are part of why they're not receiving the care that they need, or that the denial is happening because of something that their physician didn't do. And, even from my own experience, I've had insurance companies tell my patients that I'm not doing the right thing or I'm not doing my part, and that's why things are being denied. And, it's frustrating. They're just straight up lying sometimes. And you talk to any physician in the country, they will tell you the exact same thing of all the different games that they play. That being said, as these healthcare companies become bigger, more influence, the more money that they have unfortunately driven a wedge between patients and physicians and have really interrupted, the healthcare system. I almost hesitate on calling it healthcare because unfortunately what the insurance companies have done is not actually delivered healthcare in the purest sense. What they tend to do is manage disease. They're not really promoting health. I've always shared with my patients, friends, and family, my feelings about how insurance has played the game, or the game that they've laid out, and how patients, physicians, and honestly, even the hospital systems were all kind of pawns or pieces to the game in this system. It's really very unfortunate, but here we are, and I think it is really very important that the public is seeing this now. Now they're all focusing primarily on, or the media is really focusing on UnitedHealthcare, but they are all like this. All insurance companies are exactly like this. And there's been a lot of backlash, both from patients and even physicians. However, as you know, I'd like to try and bring out some questions out of the situation. The question of what is healthcare and what is it that insurance companies are actually doing for us, I think is a really key question for my patients as we move forward. Even though there is a lot of, emotion right now, and I get the sense that people are hoping that this is going to spark change, which, of course, I'm a fan of change. I think it's great. However, emotion will not trump the politics and the money aspect of things. I think that People are hoping that this tragedy will somehow trigger politicians or regulators to somehow step in uh, into the business of these commercial insurances and even Medicare, to the point where they have to actually change their policies and make it quote unquote fair. Um, it would be great if, healthcare or insurance companies would include, gym memberships and healthy food options, and um, removing some of the red tape that goes along with the delivery of care. And I hate to be that guy, but I honestly just don't think that that's ever really going to happen. I mean, sure, this is a pivotal media point. Emotions are running high right now. As details of the murder continue to come out, it's just going to keep bubbling up, bubbling up. But at the end of the day, this is about money. There's just way too much money to be made by the insurance companies, that are related to the legislators and all the politics behind it. There's just way too much money that I don't, even if there is, months of protests and this and that, the bottom line is that I don't think it's ever really going to change. From an insurance standpoint or from a business standpoint, the insurance companies, um, their goals don't really align with patient care. Their incentives are not motivated by patient positive outcomes. Their primary goal is to turn a profit for shareholders. That is not a secret. If um, Patients are essentially subscribers to their policy, and that's about it. I just don't really see this actually changing. So, what does that mean? You know, I think at the end of the day, what this should hopefully spark is a discussion about how to actually take control over your own health. There is a reliance on insurance companies or, you know, um, government subsidized healthcare to take care of you. And this is a problem. We put all of our eggs in this basket where we rely on anyone and everything else except for ourselves. The appeal and the sell of an insurance that's going to take care of every single problem as long as you pay this high premium, I think is now called into question. It's now coming to light that you are definitely paying a high premium, but you are not getting the product that you thought you signed up for. And we can either be really upset about that or we can do something about it. And what I'm hoping is that not only patients, but even physicians are going to start to look at the different models of care. Again, it's one of the big reasons that I opened up my practice and why I don't take insurance anymore is that I've come to the realization that even as a clinician, when I sign a contract with an insurance company, I agree to their rules. And no matter how I feel about it, I agree to play their game. At some point, I realized that playing their game did not allow me to practice how I wanted to practice. And in some cases, it made my patient care suboptimal. And I just hit a point where I was not going to accept that anymore. I don't think that any physician working in an insurance based model is practicing to their full potential. And I'm not even talking about like physician burnout and things like that. I'm just talking about physicians, I believe, want to do the best that they can for their patients. And if you took away, essentially these policies, these rules, they will definitely play the game differently. Now, of course, it remains to be seen, um, unless that actually happens. But again, I think that this is a point where patients are going to start looking for different models of care. They're going to start questioning what their insurance is actually purchasing. They are going to start questioning what exactly they are getting out of their insurance. Now, I'm definitely not anti insurance by any means. It does have a role, there is a place for it. But maybe this is like car insurance, where it's really meant for big car accidents, big damage, not necessarily oil changes or things like that. I do believe that that is probably the best way for us to utilize insurance is for these bigger ticket items. So, but what do you do for your day to day stuff? I think that's again comes down to the accountability aspect of things. We really need to learn how to take care of ourselves when we outsource that job. I think that we lose quality control. We also lose discipline. We want the insurance companies to motivate us or to nudge us in the right direction, and we're just not realizing that the insurance companies aren't really doing that. They're simply just denying care. It's ridiculous. At the end of the day, there was a crime committed. It is a tragedy, and a new discussion has been sparked in the country. I urge all of you to start listening to this conversation, listening to your neighbors, your friends, your family, and listening to, their experience in the American healthcare system and how insurance has helped or in a lot of cases has been negatively affected by insurance. Take it a step further, start questioning or looking for alternative models of care. Now, I'm obviously biased because I have a non-insurance based direct care practice, but honestly, I think that this is one of the models of care that needs to happen in order to essentially bring things back somewhere into the center. Because right now we're such an insurance heavy society that they have too much control. And I think we're at that point where we are realizing that insurance companies don't actually encourage health. I think we were hoping that that's what we're buying. We were buying a product where they would provide us services when the time came in order to keep us healthy and delay disability. And when that time has come, they haven't. It feels like they haven't held up their end of the bargain. So rather than let history repeat itself, rather than waiting for someone to fix this problem, I really hope that everybody starts looking at this problem, looking at for themselves, looking at their own situation, their financial situation, their physical situation, and really examine what are the things that are in my control in order to take over my health. I'm talking about simple things, sleep, food, the type of work that you do, the amount of play that you do, things like that. But then also start exploring your local resources, aside from getting your MRIs at the big hospital. Maybe you should be looking at the smaller facilities so that your hard-earned money is going to somewhere of value versus some negotiated rate with, an inflated price. But even things like your medications, do you have to get them through some of these pharmacies, or are there some mail order services that with just a little bit of research, you'll be saving like hundreds or thousands of dollars? So it's just something to think about in light of the current state of healthcare and all of the media attention. Please take advantage of this moment. Assess what your body needs, what your family needs. Look at what insurance has done for you thus far and come up with a plan moving forward. Thanks again for listening. Thank you for listening to the Talking Rehab podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.